Okay, so very excited. We got this nice, beautiful young lady. She looks 19, but she swears she's 30 years old. I don't know. I'm not sure, but anyway, she came all the way from Texas and she's very special because she is a nursing student and I like nurses and that's why I ended up marrying one. That should tell you something, yes. So there she goes. She has beautiful nose, but she wants to make it narrower. And if you take a look, she's got really thick walls. We can definitely make it narrower, but we have to be very careful not to overdo it. She also has a scar on the lower lip right there. So there's a little asymmetry. I'll have her put her lips gently together. Go ahead, put your lips together, please. Good, so you can see the left lip bone right there. Yes, open a tiny, yes, right there you can see. So we are going to excise that because that is pushing the vermilion border of the left lip downwards. So the scar along the vermilion border, that is not bad. We won't touch it. Just a mucosal aspect to get some symmetry. Let's get to work. Oh, take a look from below one more time. There we go. Fantastic. So I want to show you two things in this case. One, how you remove the lip very carefully because you don't want to cause a divot. And it's very little, so you have to be so careful. And tapering the lips is so critical. That's one. Second, with the alarplasty, when the nostrils are so small to begin with, so you really have to take a wedge from the sides without getting into the nostril a lot. You can't make it narrower. That's tricky. And we're trying to get the large size done. So how do we do it? I just want to show you. It literally looks like a nice wedge, but very careful wedge. So if you come closer, let's take a look at this. So now here you can see this is literally like 1.5 millimeters. That's it. Sometimes I have like 3 to 5, 6 even, but taking very little. And honestly, I'm going to make it even smaller when I get close to it. Now this is 8.5 millimeters width, and then I always do my marking from the alar groove right here in the midpoint up to the midpoint of the alar, and that's 10 millimeters. That's a lot. So now when I'm taking this out, you can see that this wedge narrows down really quickly over here. So when this gets narrow right here, it still has to maintain the curve. So there still is a curve there, and it'll come inwards and get in there and make it nice and narrow. It's going to be a nice large change, but you have to be very careful when we put it together because you can very easily cut too much along the nostril rim or nostril sill, and that can be a problem. That can be actually a disaster. So we have to be very careful. That's one. Second is with the lip, if you look in there. So this, I marked the area where the lip looked big. It was from here to here, maybe a little farther. So I marked the ellipse to see that's the area of the maximum bulge. So the ellipse is the widest here, but it's a very narrow ellipse, very narrow. And that's what we are going to do. Excellent. We got a plan. Let's get going. Okay, so we are all done and it looks fantastic. The nose got a nice large size change without compromising any of the nostrils, and it's really symmetric, looks beautiful. There we go. So very happy with it, and lip excision went really smooth and the lips are going to look very symmetric. As you can see, even now, despite all the local swelling, you can see the change in the difference. There we are. Fantastic. Very happy. I think we're ready to head back to Texas. Here we come, nursing school. I'm sending you a whole new nurse.